ADHD reWired, episode number 63. This is the show designed to help those of us who have really good intentions and a slightly wandering attention. My name is Eric Tivers. I'm a licensed clinical social worker, coach, and consultant. We know that starting can be the hardest part, so let's get started. But first, let me thank our sponsors. Today's podcast is brought to you by Audible.com. Get a free audiobook download and a 30-day free trial. Go to audibletrial.com/ADHD rewired. Check show notes for link. Do you need an easy way to connect with people virtually, but don't want to be hassled by downloads that don't work, connections that are complicated? Go to erictivers.com/Zoom and check out truly what I think is a revolutionarily easy to use video conferencing platform. That's erictivers.com/Zoom. Welcome back to another episode of ADHD reWired. I am thrilled to have on the show today Dr. Russell Barkley. If you don't know who Dr. Barkley is, you might be new to the world of ADHD. Russell Barkley is an internationally recognized authority on attention deficit hyperactivity disorder in children and adults. He has dedicated his career to widely disseminating science-based information about ADHD. Dr. Barkley is a clinical professor of psychiatry and pediatrics at the Medical University of South Carolina in Charleston. He's a clinical scientist, educator, and practitioner who has authored, co-authored, and co-edited 20 books. I think that's grown since that was written.
Yes, I think so.
and clinical manuals. He has published more than 200 scientific articles and books related to the nature, assessment, and treatment of ADHD and related disorders. And I have to say, for both myself and speaking on behalf of many other people, I view you as a kind of an unofficial mentor because I study your work. And so I just want to thank you for coming on the show. And even more so, thank you for everything that you have done for ADHD.
Eric, thank you. It's my pleasure. You're kind to say so.
So we were talking the other day about kind of what would be the best things for us to talk about on the show. And, you know, you have, I first saw you speak, and I shared the story with you at my very first CHAD conference that I went to the conference thinking I was this expert in ADHD because I read a couple of books and I have ADHD. And you very graciously gave me the experience of realizing how much I had to learn. I think it was when you presented your theory on executive functions, I was like, whoa.
Yeah.
So maybe we can start there and talking about executive functioning, because one of the things that you talk about is that, you know, ADHD is executive functioning deficit disorder and executive functioning as a construct of self-regulation. So just talk to us a little bit about your theory and kind of how you came to this understanding of ADHD.
Okay. I'd be glad to, of course, a subject dear to my heart, having written several books just on that topic alone. But, and by the way, let me say as an aside that you probably were quite up to date, if not more informed when you attended that meeting compared to other practitioners. But people need to understand that there is between 1,000 and 1,500 articles published every year now on ADHD in the World Science journals. I know because I track them weekly, and it's just astounding how much information is out there. So please, all of us struggle to stay up to date with this rapidly advancing body of knowledge. But back to executive functioning, I got interested in this many years ago because being a neuropsychologist by training, it was obvious even to people writing 50, 60 years ago or earlier that the symptoms of ADHD are very similar to the symptoms we see in patients who have frontal lobe disorders, albeit the symptoms are milder than somebody with a frank brain injury, but they're still very, very similar. And so, you know, a lot of us have been studying ADHD and its overlap with frontal lobe functions, particularly what are known as the executive functions. And the reason I sort of took this on even more in my research and writing is that after surveying the literature, it turned out that there are more than 25 definitions currently in use on executive functioning, which is not a good thing. Because
especially as a researcher, how do you measure it?
Yeah, absolutely.
Right.
And that leads to the second problem that you just mentioned, which is how do you assess it? If everybody's using a different definition, then what people use to assess that definition is going to vary widely, which it does. There are hundreds of tests on executive functioning, and a survey of neuropsychologists showed that people ascribe up to 33 different brain functions into this category of executive functioning, and that's just not possible either. So you can see there's mass confusion when you read about this widely used term. I mean, this has become a fashion trend in research papers, and when you read these papers, you have to be very careful to read what definition they're using, and it helps to explain why these papers often disagree with each other on their findings, whether it's with ADHD or autism or bipolar disorder or even normal development. So that's just not a good thing. It just leads to confusion at the clinical level, at the research level, at the theory building level. So, being an ambitious person, I said, I'm going to take this on. And so since 1994, I've been working in this area and trying to develop a theory of it. And the way to do that is to start with a concrete operational definition. What is executive functioning? And rather than take someone else's definition, I started with a trait that virtually every scientist would say, who studies executive functioning would say is part of executive functioning, and that is self-regulation.
Okay, so you started where everyone agrees.
Yes, let's start there. Okay, and the beauty of that is that we have a very precise definition of self-control given to us many years ago by people like B.F. Skinner and later others, Canfor, Caroli, Meichenbaum, and others who've studied self-control. And it goes simply like this. Self-control or self-regulation is any action you direct at yourself. It's something you're doing to yourself, and you're doing it to change your behavior from what it automatically would have been. And you're doing that in order to change your future, to change something that lies ahead in time.
And future can be, in a minute. Right?
A minute, 2, 5, an hour. But in humans, it can be days, weeks, or months. So we're doing something in order to increase or decrease some consequence out there in the future that is probable based upon how we act. And basically what we're doing is we're looking out for our long-term welfare, not just our short-term welfare. So that's a very good definition of self-control. 3 things: something you do to yourself to change your behavior over what you're doing now, to change your future, to make it better for you. Now, then what I did was to say, okay, an executive function is what you're doing to yourself. And if we look at it that way, and by the way, Vygotsky also looked at it that way.
Self-speech, right?
Yeah, what are you doing to yourself? And you're right, he focused more on self-speech, which is one of the executive functions. But what I did was to steal Vygotsky's idea and to generalize it to all of the executive functions. There are all types of self-directed behavior, and one of them is talking to yourself. But what are the others? So then I said, well, the most common executive functions that virtually all researchers agree on are the following 7. They are inhibition, self-awareness, nonverbal working memory, verbal working memory, emotion regulation, self-motivation, and planning and problem solving. And those 2 tend to go together. And that, by the way, that's the last one to develop. So what I did then is I took those and I said, all right, let's look at what people are doing to themselves and rephrase these ideas. And when you do that, you begin to realize what people do to control themselves. First of all, they self-direct their attention, self-awareness. They use self-restraint, inhibition.
When I read your some of your work regarding how self-awareness is an executive function, that to me that was like, that put a lot of pieces of this together. Because if you're not aware of what you're doing and why you're doing it, you can't possibly modify your intended outcome.
You absolutely can. That's why self-awareness is step 1 in executive functioning and self-control. If you're not monitoring yourself, who cares, right? Why would you do anything? Because you don't know that you're doing something wrong that may get you in trouble in the future, or that you could be doing it better to make your future better for you. So what we tend to see is that the first three that develop together are self-awareness, self-restraint, and visual imagery, which is seeing to yourself. That's the nonverbal system.
Yeah, can you talk a little bit about that? I think a lot of people get confused about the difference between verbal memory and nonverbal memory.
Well, with good reason, because in traditional studies of those two ideas, people use cognitive tests. And so they use tests that involve words, and that's the verbal working memory. And then they use tests that involve spatial arrangements for nonverbal. But if you stop and think about what people have to do to perform those tests, they have to talk to themselves to keep refreshing their short-term memory. Baddeley calls that the phonological loop. I really wish psychologists would stop using pedantic terms, because you're just talking to yourself. There's no reason to, glorify this. And the spatial tasks involve visual imagery. And so what people are doing is they're seeing to themselves using their mind's eye, and they're talking to themselves using the mind's voice. And that's where we get the verbal working memory systems. And by using these, we are able to sustain information in our mind longer than it ordinarily would be there. We keep refreshing it by doing these things. And that's where working memory comes from. So,
with Stephen Covey, who talks about begin with the end in mind. When I first heard that, I'm like, that sounds great. How the heck do you do that?
That's right. That's what he means.
Okay. Yeah. And so I think that's where some of those challenges are, is like, how do you begin with the end in mind if you can't actually imagine what that looks like?
Yeah. Well, then you can't begin with the end in mind, because it starts with visual imagery. Can you come up with some hypothetical image of what that would be like? He even, as you point out, and I love his book, by the way, I used to tape his 7 principles on my mirror in the morning so I could see it every day, and I kept it there for weeks until I had sort of internalized these ideas. I think they're just good principles to follow. But back to the point, it's hard to use that principle if you can't visually imagine that endpoint. So the other executive functions would be self-directed emotion, self-motivation, and planning and problem solving are self-play. They're forms of mental play where we take information apart and recombine it in our mind in order to invent new ideas, overcome obstacles, create multiple options for doing things. But it's actually based on children's play. It's based on manual play. I'm not the first person to say that. There's a huge literature showing that adult problem solving is predicated on human play. So there's your 7 executive functions, and all I did to simplify matters is to say that each one of them is something that you're doing to yourself. And now we can understand what this is.
And now you look at the executive functions as a developmental model, right?
Yes. Yeah.
Can you talk a little bit about that? Because I know that one of my community members asked the question. This is from Doug Harris, who's an ADHD coach. He says, I want to know why, if ADHD is a result of a delay in the development of the cortex, why everyone doesn't outgrow ADHD once their brain catches up developmentally.
Sure. Well, I think to answer that point, and then we'll come back to your question, to answer that point is delay doesn't mean lag that's temporary. It can be a permanent delay. If you think about mental retardation, now called intellectual disability, you think about dyslexia, reading disabilities, those are delays, but they're permanent. So the individual is developing at a rate that is below the rate of typical people. They're developing, and they will meet similar milestones, but they will meet them later. And when the brain finally reaches its maturity, they will level off below.
So the ceiling is kind of lower.
That's right.
Okay.
The ceiling is lower. So I think people have to be careful when they use the word delay, not to mean a temporary immaturity, but to mean a chronic lag in the development of these mental functions. Now, as with reading disorders, there is a level of executive functioning in adulthood that you have to at least make it, to at least be effective. We can call that a functional level. And it helps to think about reading. You don't need to be reading at a 12th grade level to function in society,
Right.
but you have to be reading at a 6th grade level. And most people would say 8th grade, but at least 6th grade, if you're going to fill out forms, read menus, read a newspaper, these are all aimed at about a 6th or 7th grade level. That's called the functional level of reading. And if we can get you there, if you have dyslexia, or beyond that, you're probably going to do okay in life. You're not going to do great, but you're going to function. And I think there is a functional level of executive functioning that you have to attain. And if you get past that, even if you don't make it to the normal benchmark, you're still going to function okay. But if you don't get there, then I think you're going to be in trouble. And the problem with ADHD is that many people with ADHD don't get there, or get there only marginally, or get there only erratically, and then they're in trouble. So the brain may be 2 to 3 years delayed in its development, and it may ultimately reach a similar size to normal, though that is debatable. But the architecture of the brain, the connections, the neural networks have now been shown to be and to remain abnormal, even into adulthood. So be careful with brain size. That's not a marker of brain function. Okay?
I know there was, speaking of brain size, there were some questions regarding brain imagery for diagnosis and treatment. I think there were some questions regarding, Dr. Amen. What are your thoughts on that?
Okay. Well, to finish our thoughts on executive functioning, let's go back to the question of development, and then I'll come back to neuroimaging. But the development of executive functioning, at least according to my model and consistent with other people's views, is that you don't get it all at once. It develops in stages because it probably evolved in stages. People forget that there were probably between 12 and 20 different human ancestors to current humans. There were different species of humans back then. I don't like the word species, but different, certainly earlier stages of humanity. And so each of them probably didn't have all of these executive functions, but we have them all. And so my feeling is that the first three that develop very early are self-awareness, self-restraint, and visual imagery, and then followed within 5 years or more by self-speech, and then later, within a few years, by emotion regulation, followed by self-motivation, and then ultimately, by the time you're an adolescent, you get into the development of problem solving, of planning. And so there's a staging to executive functioning that we see in typical people. And that's important because if the earlier ones are impaired, the later ones will be as well, because they're all built on a pyramid, on a hierarchy. So, and because ADHD disrupts the first three very early in life, the others are at risk because of they depend on those. So I think that's an important idea as well. Now, back to neuroimaging. While neuroimaging studies use groups of individuals and clearly show when you compare groups of ADHD to typical people, we get numerous differences, particularly in 5 brain areas. And they're significantly different, anywhere from upwards of 5 to 35% difference in the size of these 5 regions, at least that level of difference in underfunctioning in these regions.
And it's not just the prefrontal cortex we're discovering now.
No, well, it is largely the prefrontal cortex, but the prefrontal cortex projects back to other brain areas, and the areas it's projecting to, like the basal ganglia, the cerebellum, and also the visual cortex of the brain, are also underdeveloped in these individuals. And that's a great idea because it conveys to your audience that these are networks. Don't just look at one area, look at their functional connectivity. And in the past 5 years, modern neuroimaging techniques such as kurtotic tensor diffusion and so on, these are ways of studying how these areas interconnect with each other, have shown that the abnormalities in ADHD are even greater than we suspected by just looking at brain volume. The connectivity of the brain is even more disturbed, and that's important. Now, back to the question, why then isn't brain imaging useful for diagnosis? Because the overlap between the ADHD brains and normal brains is sufficient to prevent that kind of use. In order for a clinical test to be useful, the groups you're using it on have to be vastly far apart. Whereas if the distributions of the two groups overlap, and they overlap by about a third, then that means that you're not going to be able to detect that overlap and your test isn't going to be very accurate.
So the usefulness of SPECT scans.
Yes, SPECT scans, functional MRI, but especially SPECT scanning. The degree of functional differences between ADHD and normal brains is so subtle that you'll only pick it up by studying groups of people and you average them together. And the averages are what are different. But if you try to classify people, the overlap in these brains and their functioning is so large that you will fail at diagnosis. You will fail at classification. And that's what we see. And that's why everybody working in the field of neuroimaging and ADHD research will tell you these devices cannot be used for clinical practice. It doesn't matter what Dr. Amen says. They can't, because the overlap is too great. What happens is you get about a 35 to 50% rate of false positives,
that's
of
big.
false negatives rather, meaning that people with ADHD will fall in the normal range of brain functioning, and you'll classify them as normal when they're not. So for that reason, functional neuroimaging at the moment and even structural neuroimaging are not very useful. Now, I do want to hasten to add that the development of these new, very sophisticated, very refined methods for analyzing neuroimaging, such as this tensor diffusion imaging.
Yeah, what is that? That's something that's new to me.
Well, what that does is instead of looking at blood flow like SPECT scanning does to look at functioning, this uses the flow of water. I mean, water is ubiquitous in the brain, but when water hits certain structures like nerve cells, walls, synapses, and so on, it diverts. And you can actually measure how much water is being diverted or blocked or flowing or prevented. And using very sophisticated mathematics, you can create images from these. Wow. And it's a way of looking at how nerve cells connect to other areas of the brain, how pathways and networks connect. And I'm not doing justice to how sophisticated this is, but I want to tell you the images it creates are so refined that you literally can track single tracks, single bundles of nerve cells through the brain and look at where they end, and then study how, if I stimulate this area, that area activates and vice versa, looking at this functional connectivity.
So this is really cutting edge.
And what it shows is that what we thought about the brain and ADHD is even more different than the earlier neuroimaging studies show. The earlier studies looked at size, at volume. There's less brain here, there's less brain there, and so on. And it's delayed in development. The newer ones are actually creating images of these networks and fibers, and these beautiful, almost, you could frame these images as artwork, showing that the ADHD networks are not as strong, not projecting to the correct areas. They're projecting to other areas they shouldn't be projecting to. And that's probably underlying a lot of the symptoms. And also what it's showing is that people with ADHD may be developing compensatory networks because of this underdevelopment. I mean, if it stays underdeveloped for so long, the brain, being somewhat plastic, tries to find different ways to roam, so to speak.
So it sounds like what you're saying is the ADHD brain is then getting rewired.
Yes.
All right.
It's rewiring during development in order to try to function as well as it can using other routes to these endpoints and these various places in the brain. And it partially helps, but it doesn't completely compensate for that.
It seems like the more we learn, the more we realize how very much we are at the beginning of really understanding this.
Yeah, absolutely. Yeah, it's just absolutely fascinating. So expect to see a lot more of these papers on functional connectivity. If you use Google Scholar, you can just type that in, ADHD and functional connectivity, and you would see many of these studies coming up, and they're absolutely fascinating.
Oh, that's great.
Yeah.
So let me ask you a question regarding, so we go into the kind of I think the fifth and sixth stage of your phenotype model of executive functioning. So let's talk about time frames. You talk about time horizon and our ability to plan.
Yeah.
So if we can kind of break it up from kind of 18 to like 30 to like those kind of adult phases of our ability to project into the future.
Sure. What we see, let me go back to the 7 executive functions and say these are the things that are going on in your head. They're hard for people to see late in development. You can see them early. You can see children talk to themselves. But eventually it disappears. It becomes internal and cognitive in form. Now, those 7 cognitive abilities are used together like a symphony to create what we call the 5 dimensions of executive functioning in everyday life. This is what rating scales measure, are these executive functions in daily life activities. And those 5 are self-restraint, inhibition, as you can imagine, time management. The verbal and nonverbal working memory systems are related to self-organization and problem solving. And then we have emotional self-control and self-motivation. Those are the 5 things we see in people's daily lives that these 7 executive abilities are contributing to. And that's what you're going to see being disrupted by ADHD. You're not going to see the mental disruption. Only the patient is aware of that. But the people around them are going to see profound problems with impulse control, time management, planning and organization, emotional dysregulation and impulsivity, and problems with self-motivation, with the ability to stick with things. Now, as those develop over time, particularly the time management one, you're going to see a window on time open in people's behavior. In young children, they're concerned only with the now. They're not concerned about the next moment or tomorrow. As you get into elementary school, children are thinking about 12 hours ahead. As you move into late elementary school, it's a day or 2 ahead. Teenagers, maybe 3 to 5 days, up to 7 days ahead. College students, probably 1 to 3 weeks ahead. By the time you reach your 30s, you're looking out about 2 to 3 months in your life. The average thing you're contemplating in the future lies within that time frame. You are capable of looking further. I said the average thing.
Now, this is in typical development?
Yes, typical development. Okay. Now, what ADHD is doing is it's slamming that window shut, and it's causing about a 40% delay in its expansion. So the person with ADHD is like somebody about 30 to 40% younger in their sense of time and their planning and their projecting the future, their ability to anticipate the future. And that is seriously impairing because, as you know, life becomes more time sensitive as you grow up and enter adulthood. And if you're having trouble with time and time management, you're going to become more functionally impaired in adulthood than you would have thought in childhood, because children don't have to worry about time the way adults do. That is why I say in my book that adult ADHD is the worst disorder you can have with regard to time management. There is no psychiatric disorder as impairing of time as adult ADHD, which is why in my book, as you know, I refer to it as being time blind, time blindness, being nearsighted to the future. Because ADHD means you can only deal with futures that are close, that are imminent, as opposed to futures that lie a month or 2 out. And that explains a lot about what ADHD adults focus on and what they do and don't do and why they're not ready. When that future arrives, they're in crisis because they haven't gotten ready for it, and now they're scrambling around trying to cobble something together very quickly to try to deal with this. Sometimes it works, most times it doesn't.
I know for myself, when I'm going to like conferences, like in my mind, I know that there's all these things that I need to be doing like a couple weeks ahead of time, but that information comes to me like the night before.
Right. That's right. But to other people, it came a week or 2 or 3 or 8. You know, a lot of us booked our airline tickets 3 months ago, and we got our hotel and we got our rental car. And all of a sudden, the night before, the adult with ADHD is saying, oh my God, I haven't registered for this and I don't have a room. And, you know, and then they show up at the conference unregistered and beg to get in. And, you know, you obviously know these things. And that's not as important an example as, for instance, your work life. Can you imagine? I mean, if you can't manage time, you're going to be fired. You're late for work every morning. You don't have your projects ready. The stuff that you needed to do for this particular deadline are not done completely. And people, unfortunately, are not very patient with that. In fact, as Ned Hallowell says, people start to view this aspect of ADHD as a moral failing, as a choice. You just don't care. Because if you cared, you get these things done. Whereas we know it's a neurobiological deficit. It has nothing to do with choice and moral turpitude. It, in fact, is a serious neuropsychological deficit. But it tells you why people with ADHD, to cope with it, have to focus on what I call scaffolding. They have to put things around them to cope with the timing deficits, the inhibitory deficits, the problem-solving deficits, the emotional and motivational deficits. Mm-hmm. They have to create this structure outside of themselves that helps with their management, that other people have internal structure. They have to externalize it. And you know, that's a favorite word of mine when it comes to telling people with ADHD how to cope with it, is this word externalize.
Absolutely.
You have to put outside of you the things that other people do in here. Working memory is one we talked about. You can't rely on mental information to guide you. To help you remember. Right. You need to be using journals and sticky notes and cards everywhere. And reminders, your computer and all this other technology. The phrase I like is you have to offload your working memory onto other devices.
Right, or outsource it. Yeah, absolutely.
Yeah, outsource it. I'm
that. I'm looking at my time timer right now. I mean, in my office, there's no spot where I will be looking where I do not have a clock in my field of vision.
There you go.
Right across from the chair where my clients will sit, right above their head is a clock. So I don't. So it looks like I'm looking right at them, but I can also see the time.
I love it, because that's one of the 6 things we recommend for executive functioning is you have to externalize information. That's the journals and the notes and everything. You have to externalize time. That's the clock. That's the beeper. That's your Outlook program or your iPad that chimes when schedules are due. So externalize time. You have to externalize your motivation. You have to create extra sources of reward around you, such as making yourself accountable to other people for what you promised to do. Create consequences where they don't exist. You have to externalize your emotional control. Ask other people to give you cues as to when it seems that you might be drifting a little bit into higher emotionality, like you're getting a little silly, or you're talking too loud, or maybe you're starting to show a little frustration. You know, other people can kind of cue you verbally and nonverbally to help structure that. And then, of course, the problem-solving one, you externalize that by making problem-solving manual, by trying to write down the pieces of the problem and then play with them outside of your mind, not just in your mind.
Yes. So speaking of problem-solving and outsourcing, I do need to take a quick moment to thank my sponsors, because I get to outsource the post-production of this podcast, which is detail-oriented, and I don't like that part. So we will be right back. Zoom video conferencing is so easy to use that with all the extra time I saved not having to configure complicated settings, I recorded this promotion. Support ADHD rewired and check out Zoom video conferencing. Go to erictivers.com/Zoom. Again, that's erictivers.com/Zoom. Get a Zoom room. Support for this podcast comes from Audible. For a free audiobook download, go to erictivers.com/audible for a link for that free download and for some hand-picked recommendations. Go to erictivers.com/audible for your free audiobook download. The ADHD rewired 2015 Summer Coaching and Accountability Group is just around the corner. I'm going to do something that I don't think that I've ever done before. I'm going to give you my phone number and invite you to call me if you're interested in being a part of the next ADHD rewired coaching and accountability group. Call me and leave a message at 224-993-9450. That's 224-993-9450. Or go to coachingrewired.com. You could send me a message or schedule your free consultation there. That's coachingrewired, one word, .com. We start in June. Don't wait. And for you who is listening right now thinking, oh, that sounds great, I'll remember it, I'll do it later. Yes, I'm talking directly to you. Pause this audio, because I'll be here when you get back. And write it down. Put it in your phone or do it now. I know you think you'll remember, but we both know what will probably happen. Turning good intentions into actions. Write it down or go to coachingrewired.com or call me at 224-993-9450. That's 224-993-9450. My number and all the links that I just mentioned are in the show notes. Just click on your podcast app and it will be right there. Now, back to the episode. All right, Dr. Barkley, we are back. So we were just talking about executive functioning, about outsourcing these kind of cognitive structures of our brain.
Yes.
One phrase that I like to use for myself regarding time is that my internal clock never came with batteries, so I make sure all my timers have fresh batteries in them.
That's great. In one of my presentations, I show a picture of a typical clock under which it says typical person, and then a picture of an ADHD clock, and all the numbers are in a pile on the bottom of the clock circle. That's it. There's no numbers here. We have no idea what this is. However you convey it, people need to know that this invisible dimension of life that we call time is seriously affected by this disorder.
And it's hard.
And what I like about the executive functioning view of adult ADHD, which you have emphasized, is that it brings with it all of these insights, not just for understanding, but for management, that you wouldn't get if you kept viewing ADHD as an attention disorder.
Right.
Calling ADHD an attention disorder trivializes the disorder. It disrespects it. It's like Rodney Dangerfield, that name gets no respect. Whereas EFDD, executive function deficit disorder, is a profound problem.
Well, let's talk a little bit about the whole not getting respect, because we had talked a little bit about the whole notion that ADHD is not a real disorder. ADHD is a myth. All this stuff.
Yeah, I know. I smile, but it's actually very frustrating to deal with it because the media, in particular, the mainstream media and our social critics, it's not just Scientologists, although they certainly contribute to this misunderstanding, but even the mainstream media does as well. The New York Times has done so many pieces that misrepresent the disorder. It's a travesty. And I think, as you and I discussed earlier, although part of this has to do with fringe political and religious groups attacking psychiatry, attacking mental health and diagnoses, and especially medication use, some of it, I think, stems from simply the public having a profound misunderstanding about mental disorders. The public continues to believe that people's misbehavior is a result of their upbringing, of their parents and their education and their schooling, that it lies outside the person, that it's a socially induced condition. And therefore, either it doesn't exist or it's socially caused, and the root causes of the problem lie in parenting and education, and that's where the solutions need to be. Whereas we know that ADHD is one of the top 3 neurobiological disorders in psychiatry. It's rivaled only by bipolar disorder and autism for the degree to which neurobiological causes, genetic and neurological, contribute to this disorder. There is no contribution of upbringing to this disorder, but the public thinks that there is. And as long as there is this striking disparity between what the public believes and what science is showing, you'll continue to have stories in the mainstream media attacking ADHD as this social problem, this mythology, when in fact the evidence from more than 20,000 studies now is that we are dealing with a seriously genetic and biological disorder. Until those two views come together, expect to continue to see controversy in the media. But that's why you and I do what we do, which is to disseminate science, to take the knowledge out there so that at least we fight the good fight against these sources of misunderstanding to try to make people understand the science-based view of ADHD, not the mythology or the Scientology view.
And and one of the things that I've been over the last couple of years coming to the understanding of is, the science to me is clear as black and white. It's ADHD is real, and I live it every day.
Yeah.
But I think one of the things that I've struggled with myself is this, in understanding that, as we talk about emotion as a construct in ADHD, that we make decisions based on emotion and not data. So how do we take this? The data clearly shows it, and
Right.
shift this into something that we can help shift the emotional perspective of the general public who think that ADHD is a myth. Because it appears maybe that the science, that the evidence isn't doing it. So what are some of your ideas on how can we shift this conversation in society so it almost becomes absurd for someone to say that ADHD is not real?
Well, I think we can take a look at how this happened with other disorders as well. Go back to mental retardation, which previously was viewed as a socially induced condition, even 60 to 100 years ago. Autism in the 1950s was blamed on cold mothering.
Right, refrigerator mother.
And then
right.
we had the learning disabilities that were being blamed originally for hundreds of years on inadequate upbringing. You just didn't teach your children to read properly. You screwed it up. Notice the common theme here. We are very good at bashing parents, particularly mothers, for any ills that befall their children. And we have to stop doing that. That is inappropriate. But if you look at how these other disorders got into public recognition, it took a while. It took anywhere from 10 to 30 years for autism, Tourette syndrome, LD, to finally get the respect that they now get as biological disorders. Nobody blames dyslexia on upbringing, and they damn well better not be blaming autism on upbringing, because the research is clear. Now, I think what they did is they had champions in the celebrity community, in the mainstream media. They had athletes, they had actors, they had TV shows that were dedicated to these disorders. They wove these disorders into the plot lines, and eventually it became common practice that these things were there, they were acknowledged, and they were viewed as neurobiological. ADHD needs to follow a similar path, and although we're trying to do that, it's going to take a while. I mean, it took these other disorders decades, but we're getting there. We have our celebrities. We have Michael Phelps. We have Bubba Watson. We have, golfers and athletes like these, but we also have other people in the mainstream media like this. For instance, Ty Pennington from Extreme Home Makeover, Glenn Beck in the political commentary spectrum. Just Google ADHD celebrities, and you will see, or go to Attitude Magazine's website, and you will see these interviews with their parents and how their parents got them to the stage that they did. I think those are the kinds of things that help to break down these walls of prejudice by using celebrities and by doing what we do, which is disseminating knowledge. And then I think the third thing, I hesitate to say it, but it's true, is we need to start shaming people who hold these views. By shaming them, I mean clearly calling them out for these misguided views. It goes back to we used to blame homosexuality on parenting, and now look at what's happened. We have the increasing widespread acceptance of the gay lesbian movement. We have gay marriage on the agenda now. We have many people believing that these people should, that this wasn't some life choice that you needed to be trained out of, and it's taken them a long time to fight that fight of shaming people and disseminating knowledge, and then using celebrities and others, people who are present in the media, in order to help educate the public. And it works, but it takes time. It's very frustrating when you're in the middle of this, as we are, because it's not moving as fast as you and I want it to move.
Well,
but it will.
It's interesting. Are you familiar with Brene Brown's work?
Yes, yeah.
Because she talks a lot about shame and vulnerability, and how shame is this kind of insidious emotional thing that we do. It's kind of toxic. And so right before I got into starting some of her work, there was this a blog post on Psychology Today that was basically talked about how ADHD isn't real, and there's zero scientific evidence that is. So I posted a response on there basically, and I said, I used the words, and I'm thinking back to him, sort of embarrassed that I said this. I'm like, shame on you, Psychology Today, for even publishing this.
Yes. Absolutely.
So
I did the same to Scientific American. Scientific American, about maybe 6 months to a year ago, had one of their bloggers write that ADHD was actually creativity in disguise, and that if we treated it, we were going to see a reduction in creative people. This is insane. There is no evidence for this. And, here we have one of the premier popular science magazines in the world having one of its bloggers state what is clearly the least scientific view I can imagine about this, that does real harm to people. So I did write, as you did, shame on you. And then I went through and tore apart the commentary, showing that even the articles he was referencing had been misreferenced, intentionally, by the way, misreferenced. And when he was called out on it, he simply said, "Oh, well, that's okay because my point is still valid anyway, even though the evidence I marshaled was not correct." It's very frustrating. I think this is what we have to do.
I think that you had said at one time that ADHD is kind of the whipping boy of psychiatric disorders.
Yes, it is. It's the Rodney Dangerfield, which actually makes it sound funny when in fact it really isn't. It just doesn't get the respect. I'd like to see the disorder renamed. That's not going to happen. I think the name in part is part of this trivializing of the disorder. It makes it sound like all you have to do is go to Starbucks and get a coffee and you'll be just fine. Whereas if you viewed it as a self-regulation disorder, I mean, that's a profound disorder.
Now, speaking of names and renaming, in the clinical literature, there's the other ADHD or the inattentive ADHD, which is being called sluggish cognitive tempo, SCT, and you're also suggesting another name for it. Will you just talk a little bit about what SCT is, what you're recommending as a new name for it?
Well, yes. I mean, people who follow my sort of research and work know this is my more recent passion at the moment. This, along with emotion being part of ADHD and not some separate thing from it, which we can talk about if you wish. But we have known since the 1980s that there is a subset of people with attention problems who don't look like ADHD. Originally, we called them ADD without hyperactivity, but then we got rid of that term when DSM-4 and DSM-5 came out. But we've known for quite some time that there's a subset of people who have a set of symptoms that don't look like ADHD at all. And yet they're being put into the ADD, ADHD category because it's the only attention disorder. So if you have an attention disorder, this must be where you belong. When in fact, researchers have been looking at these people separately. And eventually, the term in 1986 was coined by Ben Leahy and his students, sluggish cognitive tempo, for the name of this dimension of inattention. And just briefly, it consists of staring, daydreaming, this sort of pensiveness, this kind of a sleepy, sluggish appearance, but sort of being inwardly preoccupied, slow-moving, sluggish. This pattern called sluggish cognitive tempo is not correlated with ADHD to any great extent. And is distinct from it in many ways. And so we began to study people with SCT. And there's now probably about 60, 70 publications, good science papers on the disorder, and growing, by the way, weekly now that people have caught on to this. But it's a very different disorder. For instance, ADHD is linked up with conduct problems, substance use, as you know, difficulties with anger and hostility and sometimes aggression. Whereas SCT has no link to that. SCT is linked more to depression and anxiety. We know that ADHD people are very outspoken, talkative, engaging, even overly so, in fact, whereas people with SCT tend to be reticent, shy, reserved, quiet. There are many of these kinds of differences between these two disorders. So a couple of things that have happened in the last 5 years. First of all, I and others have now done national surveys documenting that SCT is as prevalent as ADHD, both in children and adults. It's about 5% of the population. That SCT is different than ADHD in terms of its impairments.
There's about a 50% overlap, but then
which also, just about to get to that. And we've also realized they can be comorbid, which in the old view, you either had ADHD or you had ADD. In the new view, you can have ADHD and SCT, but half of the people don't. They have their separate disorders.
Okay.
But half of them do. And by the way, what we showed across the lifespan is when these two disorders coexist, they are far, far more impairing than ADHD is by itself. That each disorder brings with it its own impairments, and they're additive. And that's a very important idea, because some of what we see in severe ADHD is the fact that you've got two attention disorders, not one. Now, back to this change in label, it's a very important point. Researchers coined this term more than 30 years ago because it wasn't a clinical diagnosis and they didn't give much thought to how patients would receive it. But over the past 5 or 6 years, my students and others, we've been introducing this to patients, and I can honestly tell you that people hate this name, and well, they should. Because it is pejorative, it is derogatory, it is demeaning, and as they will tell you, it implies that I'm stupid, that I'm mentally, intellectually slow, and we don't mean to imply that. So a year ago, I wrote an article for a science journal that I think is getting some play among my colleagues, encouraging them to rename this as concentration deficit disorder. It's benign. It uses a name that's different from ADHD, whereas calling this ADD creates confusion. ADD is the old name for ADHD. So I don't know if you're just out of date when you use it or if you're referring to this group of people. Whereas CDD hasn't been used for anything else. It implies that there's a problem with concentration, shows there's another attention disorder, but carries no derogatory baggage that is offensive to people. And so I think you're going to see this term used more and more. I certainly used it in my textbook that was published in January, the 4th edition of my handbook, and I'm trying to encourage people so that we don't, get on this tangent of using offensive terms that eventually patients are going to reject. So,
When I first heard you talk about this, and when you talk about the staring, my first thought was, oh crap, because I sometimes get in this like gaze where I'm just like, where I know I'm doing it and I can't even avert my attention away from just being like spaced out. So it's like I'm semi-aware of it. But then you also talked about how it's consistent, and where we know ADHD, the one thing that's consistent about it is it's inconsistent.
Yes, that's right. It's highly variable. Right. Yeah.
So,
but your point is well taken. Everybody has some SCT-like traits. We all periodically stare. We all engage in mind wandering. We all have trouble with daydreaming sometimes.
Right.
So if I'm driving to work and it's boring, I start to think about other things and I miss the turn to the parking garage. That's a good example of all of us having a little SCT, CDD. Right. All of us engage a little bit in mind wandering. The point is, when this becomes pathological, when every time you're engaged in some primary activity that isn't very interesting, your mind starts to wander away, and that mind wandering comes back to interfere with what you're doing, you've crossed a line into the disorder category. You are experiencing impairment in major life activities from this. And that's where the disorder begins.
And I want to talk a little bit, as we have about 9 minutes left here.
Okay.
About, the functional impairment and how ADHD really can be, I view ADHD as very much of a spectrum disorder. It can be mildly impairing. It can be severely impairing.
Yes.
And we know that ADHD often travels with friends, meaning other, coexisting disorders.
Yes, it does.
So I know that, part of your kind of passion for ADHD does come from a very personal place.
Yes, it does.
Yeah. You had lost your brother who had pretty severe ADHD. Would you mind sharing a little bit about that?
Yeah. I'm happy to talk about it, just because it makes what was a senseless death hopefully have some meaning, and maybe other people can benefit from it. I have had a fraternal twin brother, Ron, who has been severe ADHD with learning disabilities going back well into our preschool years. Before Ron was 5 years of age, he had at least 3 or 4 life-threatening accidental injuries, ran in front of cars, dove into lakes that were only 4 feet deep, hitting his head, lacerated himself, practically set fire to our home, playing with matches and things like that. Ron was very, very ADHD. He was a great guy. He was a funny guy. He was very active and talkative, but he was very poor student. And eventually, he left school at 16 years of age to pursue rock music, and became a very gifted rock musician, played with hundreds of bands all over the U.S., and always waiting for that big break and that next American Idol moment or something, which unfortunately never came. But if you watched him play, I would liken him, I think quite honestly, to people like Stevie Ray Vaughan, Eric Clapton.
Wow.
I mean, you literally could see him channeling music as he played. But he was very good. But his impulsiveness and his risk-taking and his poor organization and his emotions always got the best of him. So unfortunately, his relationships with his wives didn't last very long, or with his 3 children. And he would engage in a lot of risk-taking behavior. He always drove without seatbelts, always speeding, always using alcohol more than he should have, as is typical in the music community. Drugs become a serious part of life. He was in and out of jail from time to time for drug possession, nothing violent, but certainly the use of drugs. And so eventually in his 50s, unfortunately, Ron was just out driving one of the back roads in the Adirondack Mountains of upstate New York. But, he was going 40 on a 25-mile-an-hour dirt mountain road, wasn't wearing a seatbelt, and unfortunately just caught the wheel of the car in a ditch and overcorrected and rolled the vehicle and was thrown out of it, and it rolled on him and killed him instantly, in a very, very sad moment in our lives. But it just illustrates the life-threatening nature that this disorder can have, not just with regard to drug use, but with regard to, poor diet, poor health care, poor nutrition. And then on top of that, the connection between ADHD and driving risks is very strong. ADHD is the worst disorder you can have, actually, and operate a motor vehicle. And Ron was a classic case of that. And eventually it caught up with him. He was in and out of treatment. There were times he was willing to get treated. There were other times he denied that there was any problem and therefore stopped treatment. This happened to have occurred in one of those times when he was not in treatment. So very, very sad to see this highly creative musician end his life at 56 years of age through a very trivial single car accident that was preventable.
I'm very sorry for your loss, man. That's
thank you.
And I when I first read that in the back of Taking Charge of Adult ADHD, I was glad that you put that in there, because I think it makes it very real.
And I hope that it serves to forewarn others that this is a disorder that needs to be taken seriously. It's one of the most impairing outpatient disorders that you and I see. It more impairing than depression, anxiety, learning problems, relationship issues, because it interferes with almost every major area of life, including life expectancy. We now have studies to show that people with ADHD are 3 times more likely to die before the age of 46, and that their life expectancy is probably going to be shortened by a number of years, anywhere, my guess would be 7 to 15 years or more, if it isn't treated. It's a risk factor for coronary heart disease. We've already mentioned accidental injury, drug use, probably cancer, because all of them come back to this underlying problem with self-regulation. And self-regulation problems are the single biggest cause of mortality.
Yeah. Thank you for sharing.
Yeah, you're welcome.
I do see behind you, is that a bass guitar?
Yes, it is.
Do you play?
I've gone back to it because, speaking of my brother, when he left school to learn rock music, I didn't leave school, but my older brother took up the drums and I took up the bass guitar, and we played in the Maryland, Washington, D.C. area for a number of years while I was in high school and early college. In fact, you can read the history of rock and roll in the D.C. area called I believe Capital Rock is the name of the book. And in there, you'll see our band being mentioned as contributing to the history of rock and roll. But I played in the Georgetown bars and the campuses of the colleges and at the military bases. And so a number of years ago, actually, it was the year my brother passed away, to help with my grieving, and I'm going to start tearing up here, my wife of 46 years, who I've known since high school, went out and bought me a bass guitar and said, I think you need to get back into this. So, yes, that's what you see. And I play around with it, what I call karaoke bass, and play to the old 60s and 70s rock songs. So I have a good time with it.
Well, maybe at some meeting at some point in the future, I play keyboard and piano. So,
oh my goodness, yeah.
Maybe at some point you and I can have a little jam session.
Well, and we'll get Sam Goldstein, who plays lead guitar, and Mike Gordon also plays a very good guitar, and not to mention other instruments as well. So, I think we're on to something here.
That would be incredible. So, now that we're kind of ending the show here, I do want to just leave a few moments for the random question round. This is the part of the show that has nothing to do with ADHD, which then paradoxically has everything to do with ADHD. Are you ready?
I'd be happy. Yeah.
All right. So if you can come up with an invention or an improvement upon a certain product out there, what would it be?
Oh my goodness. Oh, that's tough. What would it be? You've put me to shame here. It would probably be taking, technology like the Apple Watch or other things, and reprogramming it for self-regulation. Yeah.
Brilliant.
Yeah.
Okay. I think I might actually know the answer to this question now, but maybe not.
Okay.
If you were to enter a talent show, what would your talent be?
I think you saw it in the background. I certainly can't sing. My brothers never let me near a microphone. I was one of the few who had no voice. So certainly it would be that instrument. Yeah. So it certainly wouldn't be golf or sports.
Okay. What animal freaks you out the most?
Oh, my goodness. Not many, but probably sudden movement of things like, maybe snakes and spiders. Once I see them, I'm fine with them, but I think it's just sudden motion. So
there was a great podcast episode on a podcast called Invisibilia, NPR, which actually talks all about the movement of snakes and it's because it's like unexplainable to our mind in some ways on why that is.
Well, I actually, since you mentioned that, one that does occasionally freak me out, though I'm a little more rational about it, are bees, especially stinging bees, because I nearly died when I was 8 years old from falling into an underground huge nest of yellow jackets.
Oh my gosh.
And, suffered cardiac arrest and had to be resuscitated and everything. So to this day, I still have occasional nightmares.
I bet your cortisol is flooding you when you see some bees.
Yes.
All right, let me ask you one last question.
Sure.
Nutritional value, kind of irrelevant on this.
Yeah.
If every meal had to be the same from now on, what would you eat?
I would eat steak.
You'd eat steak.
I would eat steak. I tell you, I come back to that 2 or 3 times a week in some form or another, but I am definitely a carnivore.
And how do you like yours cooked?
Oh, I cooked one last night. We did filet mignons on the grill. I cook them for about 3 to 4 minutes on the grill to sear them with a little olive oil and Italian seasonings and some sea salt. And then I finish them off in the oven for about 8 to 10 minutes, and I like them about medium rare. And that and a bottle of red wine and some grilled veggies on the side, man, that is to die for.
Well, if I might end this by calling you Russ, I'm just saying, Russ, anytime you're in Northern Illinois, you have an open invitation to come out to Vola, which is a small town out here in Northern Illinois, and I will make you a steak just the way you like it.
Eric, thank you so much. What a pleasure.
Russ, can you tell people how they can reach you and kind of find more information about you?
The best way is through my 2 websites, russellbarkley.org. That's RussellBarkley.org, and my other website, to which I've posted about 35 hours of my lectures since I'm gradually moving into retirement now, is ADHDlectures.com, and they're free. So those 2 websites will get you the information you need to know.
Well, thank you so much for spending the hour with me and for everything that you have done and are continuing to do for ADHD.
Thank you for having me.
Thank you so much.
You're welcome.
That was so incredibly fun for me. we know with ADHD, we sometimes call it the disorder of good intentions. And I want to tell you that over a year ago when I first started my podcast, I kept thinking about, man, how awesome would it be if I could get an interview with Dr. Russell Barkley. And, my only regret was that I didn't ask him sooner. So I want to thank, personally, Carolyn Dargenio, who helped me craft my email to Dr. Barkley in asking him, to be on the show. I also want to, thank Meredith, Deshaun, Rich, Doug, Donna, and Virginia and Colleen for submitting questions, and Jenny for submitting questions for me to ask. I didn't get to all of them, but I did get to a few of them. So I hope you enjoyed this as much as I did. I'm kind of having that my facial muscles or facial, you know what I mean, are hurting from smiling so much. I just got off the interview with him. That was a lot of fun, but that's all the time we got. So until next time, cue the outro music. Thank you for listening to another episode of ADHD reWired. If you're new to the show, welcome to ADHD reWired. We are more than just a podcast. We are a community. You can see a full outline of this and all other episodes with links and other resources mentioned at ADHDrewired.com. Help support this podcast by checking out my sponsors, erictivers.com/Zoom and erictivers.com/Audible. And next time you shop Amazon, use the search portal at ADHDrewired.com. You can also help support this podcast by leaving an honest review in iTunes or Stitcher. And don't forget, hit subscribe so you never miss an episode. Don't just be a passive listener, be an active member of the community. ADHD reWired is on Facebook. You can like our page, but submit your request to join our free and growing community. We are almost at 200 members. And please check your other inbox because I screen everyone before they come into the group. Speaking of groups, ADHD reWired summer coaching groups are now forming. Schedule your free 20-minute consultation with me at coachingrewired.com. If you're looking to get a better handle on time management, project management, and productivity while being connected to a group of like-minded people who all support you and genuinely understand your challenges, join the next ADHD reWired Coaching and Accountability Group. We begin in June 2015. There's a reason why 8 out of the 12 members of our last group requested an extension group, and that group is starting this week. Go to coachingrewired.com to complete the interest form or to schedule your free consultation with me. That's coachingrewired.com. Do you have a question or comment that you want to be played on an upcoming episode? Go to speakpipe.com/ADHD rewired and leave a message from your computer or from the SpeakPipe app. I want to thank you for donating to the Not Another 1 in 20 campaign that we launched during last week's episode. Recently, a young adult client of mine died from a diabetic coma, and in honor, we are raising money to help Carolyn Dargenio's 7-year-old son, who has type 1 diabetes, get a device that would alert his mom if his levels are too high or too low. This device could have saved my client's life. We are raising $3,000 and your contribution can help. Go to erictivers.com/T1D for a link to make a donation. And thank you. And thanks again for listening. And don't forget, it takes courage to do things that are hard, but the things that are hard are always worth doing. Until next time.